This is a very poor country, and we're right here in the middle of the richest country in all of Africa. 2.2 million people, a third of all the adults are living with HIV, and the mountains are where a lot of people live. This is the most challenging situation I've ever been in. First of all, you can only get there by airplane. Secondly, the nature of the disease patterns. We've just never dealt with a country before that has 30% of its adults living with HIV. That just complicates everything. Tuberculosis. Now we know drug-resistant tuberculosis is a major problem. We just started doing what we have always done, which is to try to bring good people who've had experience in delivering healthcare in very poor settings.
Okay, next Monday.
Hiring lots of local people and then working with them to try to dramatically upgrade the quality of services.
Atlama, 30 years old, newly diagnosed HIV today, comes in with chronic diarrhea and also acute hearing loss. So on Wednesday she lost her ability to hear.
You know, we were very lucky because one of our most experienced doctors, Jennifer Furin, volunteered to come in and lead the team.
So at this point, I think that lady needs to move out when she's ready to go. She needs to be admitted and the usual. So I left a note in the Bukana.
It really takes a person like Jen with her extraordinary background, but also the fact that she received such great training at Harvard Medical School, at Brigham Women's Hospital. She's bringing all those things here with her.
She should get ceftriaxone, 2 grams. She should get started on TB treatment and high-dose fluconazole. With the hearing loss, I can't think of anything other than meningitis that this could be. And we should start her on prednisone. So let me just put a note in the medical officer.
The fact that things have developed and grown so quickly here is a fantastic testament to Jennifer, to Jonas Rigadon, one of our physicians who came from Haiti.
It's okay, man. Almost finished.
Jonas was trained in the Partners in Health method in the clinics in Haiti. He's another extremely accomplished individual. Studied for 2 years in Belgium, speaks French fluently, speaks English fluently, speaks Haitian Creole, and he's now here working with Jen to develop these clinical services that, you know, are, I think, as good as any in Africa.
Exactly. It means there is no really confidentiality, but the patient is always excited also to come to see doctor because they are sick and they need help. They come to get help. But we are improving everything. Like you can see, the new clinic we are here and infection control and everything. Everything is getting better in a few months.
These are places that have never had a primary healthcare system. So a lot of the kids haven't had any vaccinations. There's no such thing as a regular doctor. In fact, until we came in, there was no such thing as a medical record. In other words, you know, if you're really sick and about to drop dead, you come to the clinic and they try to do something or other. They ask you to pay, and if you can't pay and if you can't do anything, you die. And so a lot of these places are known as places where you go to die, as opposed to places that reach out to you to keep you healthy. Now, that's what we're trying to do here.
You know, I think the painful feet are probably nutritional in HIV neuropathy, and that's how I would put this story together. Although it could be wrong, and the reason we're going to have her stay is so you guys can watch her. When I go to the Brigham, there's 100 doctors on the floor that I'm on, and if I forget to do something properly, somebody else picks it up. So in some ways this job is very stressful because if I forget to do something for her, it could mean the difference between her life and death as well. But I don't suppose one can expect to know the joy of saving a life if one isn't expected to also know the pain of losing one. And so that's what we do here.
We're not giving in to the poverty and inequality and terrible conditions here. Our goal has always been that all the fruits of the extraordinary labors of people in the hospitals, in the laboratories, making new tools that have just transformed medicine, our conviction always has been that everyone on the face of the earth deserves to have access to those things. And we want to train the next cadre of Jennifer Furin's.
He's too skinny.
Who will be able to go to all corners of the earth to deliver these kinds of tools.
Yeah, you should come and see us.